What is a sprained ankle? A sprained ankle is an injury that occurs when a ligament which connects the bone in the foot or ankle is torn or stretched beyond its normal range of movement. This can cause swelling, pain, and loss of function. The three grades of ankle sprains based on how much damage is done to the ligaments are Grade 1 sprain, slight stretching and some damage to the fibers of the ligament. Grade 2 sprain, partial tearing of the ligament. If the ankle joint is examined and moved in certain ways, abnormal looseness of the ankle joint occurs. Grade 3 sprain, complete tear of the ligament. If the examiner pulls or pushes on the ankle joint in certain movement, gross instability occurs. What causes a sprained ankle? The cause of the soccer player's sprained ankle was due to his rapid shifting movements, which led to his foot being inverted while trying to run for the ball. This caused his lateral ligaments to stretch and tear. This common ankle sprain is known as an inversion ankle sprain. Due to this injury being caused by internal forces and ligaments being injured, the injury is classified as an indirect soft tissue injury. To assess the injury and determine whether the soccer player should continue to play or seek medical attention, toe taps method should be used. Whilst using toe taps, it is important to remember that when one level cannot be completed by the athlete, then you should stop the assessment here and treat the injury. T for talk. Talk to the injured athlete to gather information about the injury and to determine what happened. O for observe. Observe the athlete by visually examining if there is any deformities. Do this by comparing the injured ankle to the other ankle to see if there is any noticeable differences. There are no noticeable differences, so the next step is T for touch. If there is no obvious deformity, the next step is to touch the sprained ankle to determine the extent of the injury. As you can see, when the athlete's ankle is being touched, the athlete feels pain and therefore should stop the assessment and seek medical attention. However, if they didn't feel pain, the next step is A for active movement. Make the athlete attempt to move the ankle to determine its ability to play. P for passive movement. The coach should move the injured ankle to see the range of movement without pain. S for skills test. If the athlete is able to perform movements similar to those required in soccer, such as kicking the ball, then the athlete may return to play. RICER procedure is the most effective way to manage soft tissue injuries in its acute inflammatory phase.
The injured area must be kept stable and relatively inactive for the first 48 to 72 hours, or depending on how severe the sprained ankle is.
I for ice. Ice should be applied by applying directly to the ankle as well as the surrounding area for 20 minutes per hour, reducing swelling and inflammation. Remember not to apply ice directly to the skin.
C for compression. Compression should be applied using a bandage over the injured ankle and the surrounding area to reduce swelling and to provide support. E for elevation. Elevate the ankle above the level of the heart while seated or lying down to ease inflammation as it reduces the volume and pressure of the blood flow. R for referral. Refer to a GP or physio as soon as possible to determine how severe the sprained ankle is and to commence rehabilitation.
Rehabilitation procedures aims to restore the athlete to their pre-injury level of fitness and movement. Suitable techniques such as progressive mobilization, graduated exercise training, and the use of heat and cold may greatly reduce the rehabilitation time for the athlete. Progressive mobilization is important as inactivity can increase the formation of scar tissue. This method will also gradually increase the range of movement over time. Stretching restores range of motion and helps increase muscles and tendon with the use of slow static stretches, dynamic stretches, and PNF stretches. The stretch should be held for approximately 15 seconds. While seated, bring the ankle and foot all the way up as much as you can. Do this slowly while feeling a stretch in your calf. Conditioning allows the muscles involved to be strengthened gradually to prevent muscle atrophy. It is important to avoid reversibility and progressively overload when conditioning to keep in shape. The use of resistance band will help strengthen the muscles. Calf raises are also helpful in strengthening your muscles as it uses your own body weight as a resistance. When you feel comfortable doing calf raises, increase the pressure by doing it with one foot. Preserving as much as possible of the body's full fitness during the injury rehabilitation allows return to play without losing required sport-specific skills such as flexibility, strength, and endurance. The application of heat and cold to the sprained ankle is important in the healing process. The use of cold during the acute phase of the injury in the form of ice gel, ice bags, and ice massage can reduce pain and swelling. The use of heat should not be used on the early stages of the injury. The use of heat in the form of heat packs and hydrotherapy can help decrease the pain, increase ability to stretch, reduce joint stiffness, and increase tissue healing to the sprained ankle. Before the athlete returns back to full competition, the athlete must train and re-establish movement skills, specific game skills, and confidence to prevent the risk of re-injury. Athletes should train in an environment that is close as possible to competition conditions and undertake full training sessions such as warm-up skills, drills, match play, and cool-down without any pain in the injured area. A rehabilitation program is successful if the athlete is able to undertake a full training session and participate in all elements. It indicates that the athlete is ready to return to play once they have successfully undertaken the rehabilitation program and the sprained ankle has returned to its normal state. Having both pre-test and post-test results to monitor the
Agility
progress for
test.
fitness allows the coach or medical practitioner to make an educated decision on the player's present fitness without risking further injury. Returning to play for an injury may depend on them meeting a
Go.
certain criteria or a fitness test to determine their readiness. This, for example, tests the soccer player's agility. The ankle injury may impact on the athlete's psychological well-being that can affect an athlete's ability to play. Although the athlete has physically recovered from the injury, they may feel anxious and lacking confidence in returning to play due to the fear of getting injured again. It is important that the athletes are psychologically ready before returning to play, as lack of confidence can lead to poor skills and technique that can cause injury. Taping the sprained ankle can provide support and awareness to the athlete, which can act as a psychological form of treatment. The athlete may need to undergo through more specific warm-up and stretch routines specifically to work on the recovered area to prepare it for the demands it may encounter in the game. Warm-ups will ensure muscles are warm, stretched, and ready for physical activity to prevent further injury.
Okay.
Forward leg swings, 10 per leg, will loosen your quads and hamstrings. Return to play policies and procedures. Sport clubs have a responsibility to ensure that policies and procedures are in place for return from an injury. Return to play policies and procedures play an important role in keeping athletes safe and to prevent further injury. Coaches, GPs, physiotherapists, and more have an important role in establishing guidelines and deciding whether an athlete is ready to play. Athletes must first get clearance from their GPs or physiotherapists, as they will ensure if you are ready to play. A policy, for example, is that people who have suffered from amnesia after a concussion in soccer is not allowed to play until 1 week after the concussion. However, if they do not experience unconsciousness or amnesia, they are allowed to return to play the game after 15 minutes. Ethical considerations. Ethical considerations can play a significant role in determining when an athlete returns to play. Athletes may feel the pressure from their coaches, teammates, and financial issues to return to play as soon as possible. The pressures on an athlete may increase their use of painkillers. An athlete who returns to play too early and does not follow appropriate recovery procedures, as well as the use of painkillers, can increase the likelihood of further damage.
Okay.